When a celebrity dies, the news cycle moves at lightning speed. The pressure to report, to be the first with the story, is immense. This rush often leads to what can be called the first draft of tragedy. Initial reports are pieced together from preliminary information, anonymous sources, and educated guesses. A narrative is formed quickly, shaped by the most readily available facts. This first story is what floods our screens and social media feeds. It is often simple, direct, and easy to digest. Found unresponsive. Suspected heart failure. Possible overdose. These phrases become the headlines that define the event in its crucial first hours. This initial narrative, however, is rarely the full story. It is a sketch, not a detailed portrait. The reality of determining a cause of death is a slow, meticulous process. It involves autopsies, toxicology reports, and careful investigation by coroners and medical examiners. This work takes time, often weeks or even months. But the public's thirst for information is immediate. The media, in its effort to satisfy this demand, often reports on speculation as if it were fact. An early theory from a law enforcement source can become a global headline before it has been properly verified. This creates a powerful first impression that can be very difficult to change later on. The problem is that this first draft of tragedy often sticks. Our brains are wired to hold on to the first piece of information we receive. This is known as the anchoring effect. Even when new, more accurate information comes to light, the initial story lingers in the public consciousness. We remember the first headline we read. We remember the first theory we heard. The corrected story, the result of careful medical examination, often receives far less attention. It is a quiet update, not a breaking news banner. The definitive cause of death may be buried in a detailed coroner's report that few people will ever read. This video is dedicated to looking past that first, hasty draft. We will be examining the cases where the initial story was not just incomplete, but fundamentally wrong. We are focusing on the gap between the initial public narrative and the final medical truth. This exploration is crucial because it highlights the fallibility of our information systems and the complexities of modern medicine. It reveals how easily a life story can be miswritten in its final, most critical chapter. By understanding how these inaccuracies happen, we can learn to be more critical consumers of news and more empathetic witnesses to tragedy, waiting for the full story to be told. We place an immense amount of trust in medical professionals. Doctors, coroners, and medical examiners are the experts we rely on to provide answers in times of crisis and loss. They are the keepers of scientific truth, the ones who can explain the inexplicable. Their conclusions are supposed to be definitive based on evidence, training, and experience. When they issue a cause of death, we expect it to be the final word. It is the foundation upon which legal proceedings are built, insurance claims are settled, and families begin the long, difficult process of finding closure. This trust is a cornerstone of our society. It allows us to make sense of life's most painful moments. But what happens when that trust is shaken? What happens when the experts get it wrong? The idea of a misdiagnosis, especially in determining the cause of a death, is deeply unsettling. It suggests that the system we rely on is not foolproof. It reveals that even the most highly trained professionals are human and capable of error. A misdiagnosis can happen for many reasons. Sometimes symptoms of a rare condition mimic those of a more common one. Sometimes crucial information about a patient's medical history is missing. And sometimes tragically it can be due to simple human error or negligence. For celebrities, the pressure on medical professionals is even more intense. The whole world is watching. Every decision is scrutinized by the media and the public. This high-stakes environment can, paradoxically, increase the risk of error. The rush to provide answers can lead to overlooking subtle clues. The desire to protect a famous person's privacy can sometimes result in incomplete information being shared with the medical team. In these situations, the initial diagnosis might be a logical conclusion based on the available evidence, but it may not be the correct one. The truth may be hidden deeper, waiting to be uncovered by more thorough testing or a second look. This is why the stories we are about to explore are so important. They are not just tales of Hollywood tragedy, they are profound case studies in the limits of medical certainty. They force us to confront an uncomfortable reality, that a death certificate is not always the end of the story. It can sometimes be the beginning of a new investigation, a new search for a more accurate truth. These cases challenge our assumptions and remind us that science is a process of discovery, not a collection of absolute facts. They raise critical questions about accountability, medical practice, and our right to know what really happened to the people we admire. Human beings are natural storytellers and puzzle solvers. We're inherently driven to find patterns, connect dots, and uncover hidden meanings. This is especially true when we're faced with a mystery. An unsolved crime, a historical puzzle, or the unexplained death of a famous person captures our collective imagination like nothing else. We're just not content with loose ends or unanswered questions. We feel this deep psychological need for closure for a narrative that makes sense from beginning to end. When a celebrity dies under mysterious circumstances, it presents us with the ultimate puzzle. We have all the public pieces of their life and we're compelled to figure out how they fit with the final, tragic piece of their death. This fascination is really amplified by the true crime genre, which has just exploded in popularity. Podcasts, documentaries, and online forums have turned millions of us into armchair detectives. We've learned about forensic science, criminal psychology, and investigative procedures. We're more equipped than ever to analyze evidence and question official narratives. This newfound public expertise, combined with a healthy dose of skepticism towards authority, fuels our desire to dig deeper into celebrity deaths. We're no longer passive recipients of information. We're active participants in the search for truth, discussing theories and sharing information in communities all around the world. The media and fan communities play a huge role in keeping these mysteries alive. A single article questioning an autopsy report can spark a new wave of public interest. A well-researched documentary can present evidence that challenges the original findings. Fan forums become these hubs of collaborative investigation, where dedicated individuals spend countless hours poring over public records and timelines. This collective effort can sometimes unearth new information or highlight inconsistencies that were previously ignored. The public's refusal to let a story die can keep pressure on authorities and, in some cases, even lead to a re-examination of the evidence. In this series, we'll step into the role of these investigators. We'll examine the evidence, listen to the experts, and explore the alternate theories. Our goal isn't to promote baseless conspiracies, but to engage in a thoughtful and empathetic examination of cases where the initial story was proven to be flawed. We'll honor the memory of these beloved celebrities by seeking a more complete understanding of their final days. The search for truth is a way of saying that their lives mattered, and that the details of their deaths matter too. It's a journey into the heart of medical mysteries driven by our unending fascination with what really happened. We often view doctors as figures of unwavering authority. This perception is built on years of rigorous training and the remarkable successes of modern medicine. However, doctors are human. They experience fatigue after long shifts, face immense pressure, and can be subject to cognitive biases. Pattern recognition, a crucial tool, can also become a trap. Constant exposure to trauma can lead to burnout, impacting decision-making. This human factor is the starting point for understanding how misdiagnoses occur. Recognizing this fallibility fosters a more realistic and compassionate view. It encourages us to appreciate systems like second opinions. The human body is an incredibly complex system, and its methods of signaling distress are not always straightforward. A disease doesn't always announce itself with a clear, unambiguous sign. Instead, it can wear a disguise, presenting symptoms that mimic other conditions. This is the great challenge of diagnostics, interpreting a language that's often cryptic and misleading. A patient might complain of fatigue, headaches, and general body aches. These are classic signs of the common flu, overwork, or stress. However, they can also be early whispers of meningitis, a heart problem, or certain types of cancer. The body is sending a signal, but the signal itself is a riddle. This masking of symptoms is a primary reason why misdiagnoses happen, even with the most diligent of doctors. Medical training focuses on typical presentations, the textbook cases, but patients rarely conform to the textbook. A heart attack is associated with crushing chest pain and pain radiating down the left arm. Yet for many, especially women, the symptoms can be far more subtle: nausea, jaw pain, shortness of breath, or extreme fatigue. A doctor looking for classic signs might dismiss these as indigestion or anxiety, sending a patient home with false security when they're in mortal danger. Consider a pulmonary embolism, a blood clot in the lungs, which is notoriously difficult to diagnose. Its symptoms include shortness of breath, cough, and chest pain, easily mistaken for pneumonia, asthma, or panic attacks. Without proper testing, the true cause can be missed. The body is putting on a performance, acting out the script of a different illness. It's the doctor's job to see through this performance, to look for subtle clues that reveal the true problem. This requires medical intuition and willingness to question the obvious. When we look at celebrity cases, mass symptoms are often key factors in tragedy. A star might complain about feeling unwell, but their symptoms are vague and nonspecific. Given their high-stress lifestyles, complaints are easily attributed to exhaustion. The underlying condition continues to develop, hidden behind a mask of normalcy until it's too late. The autopsy reveals a truth that was there all along, but was tragically misinterpreted. The body was speaking, but everyone was hearing the wrong message. Treating a celebrity transforms the examination room into a potential stage. The unseen audience of the global media creates intense pressure. Every decision faces extraordinary scrutiny, and mistakes can become career-ending scandals. The temptation to deviate from protocols to accommodate a famous patient is a great danger. This can lead to VIP syndrome, where they receive a lower standard of care because of their celebrity. Celebrities may withhold medical history, creating dangerous information gaps. This environment can also lead to overprescription and dependency. The story of a celebrity death is often incomplete without examining the pressures their fame placed on their medical team. In medicine, first impressions can be critical diagnostic tools. Doctors quickly form a preliminary hypothesis, an anchor, which becomes the starting point for investigation. This cognitive shortcut is efficient, but when wrong, it's difficult to dislodge, setting the diagnostic process on a wrong course. This is anchoring bias, a common cognitive error. Overcoming it requires a conscious effort to remain open-minded and seek evidence that could disprove the initial hypothesis. A doctor is a medical detective, only as good as the clues they're given. The most important clue is the patient's medical history. When this history is incomplete, the doctor is forced to work from a broken script, which can lead to wrong conclusions. For celebrities, the problem is often magnified. They may see multiple doctors creating a scattered medical record. Furthermore, there can be a deliberate withholding of information that can be fatal. Without vital information, a safe prescription can become a lethal poison. The tragedy lies in preventing a complete exchange of information that could have saved a life. Sometimes a misdiagnosis is not the fault of a single doctor's error, but the result of a larger systemic failure within the medical institution itself. A hospital or clinic is a complex organization with many moving parts: doctors, nurses, technicians, administrators, and information systems. For this system to function effectively, communication and coordination must be seamless. When there are cracks in this foundation, when communication breaks down, protocols are not followed, or technology fails, the risk of error increases dramatically for every patient who walks through the doors. In these instances, the institution itself can be considered sick, creating an environment where mistakes are more likely to happen. One common systemic failure is poor communication between different departments or shifts. A crucial piece of information noted by a night nurse might not be effectively passed on to the day shift doctor. A radiologist's urgent finding on a scan might sit in an electronic inbox for hours before being seen by the treating physician. In a busy, understaffed hospital, these communication gaps are distressingly common. The patient's care becomes fragmented, with each provider only having a piece of the puzzle. This lack of a unified, coherent picture can lead directly to a misdiagnosis, as no single person is synthesizing all the available information to see the true clinical story that is unfolding. Another systemic issue is an over-reliance on flawed protocols or outdated technology. A hospital's electronic health record system might be clunky and difficult to navigate, making it easy for a doctor to miss a critical lab result or allergy alert. Diagnostic protocols might not be updated to reflect the latest medical research, leading physicians to follow a diagnostic pathway that is no longer considered the best practice. These are not individual failings, but institutional ones. The tools and systems designed to support doctors and ensure patient safety can, if poorly designed or implemented, become obstacles that actively contribute to medical errors, creating a culture where mistakes are not just possible, but probable. In the context of a celebrity's death, these systemic failures can be particularly revealing. An investigation might show that a fatal overdose was the end result of a cascade of small errors: a pharmacy computer that failed to flag a dangerous drug combination, a breakdown in communication between two prescribing doctors, and a hospital protocol that did not require a follow-up for patients on high-risk medications. The blame cannot be placed on one person, but on the system as a whole. These cases serve as a stark warning that patient safety is not just about having skilled doctors, it is about building and maintaining a resilient, well-functioning healthcare system where errors are anticipated and caught before they can lead to tragedy. When a celebrity dies unexpectedly, suspicion often falls on drugs or alcohol. The toxicology report becomes anticipated, promising a clear answer. However, toxicology is not as simple as a yes or no answer. The mere presence of a drug does not automatically mean it was the cause of death. Misinterpreting the toxicology report can lead to a fundamental misunderstanding. Determining toxic and lethal levels can vary dramatically from person to person. Post-mortem toxicology is fraught with complications. After death, drugs can redistribute. Often, initial headlines are driven by a simplified reading of toxicology findings, but careful analysis might reveal a different story. The autopsy is often seen as the ultimate source of truth. It is a meticulous, hands-on examination of the body. The autopsy can reveal a hidden tumor, a ruptured aneurysm, or a congenital heart defect. However, the autopsy itself is a human procedure, subject to limitations and interpretations. Some causes of death leave no visible trace. A person can die from a fatal cardiac arrhythmia that leaves the heart muscle looking perfectly normal. The skill and experience of the pathologist are also critical variables. Second autopsies can sometimes yield different conclusions, offering a different expert interpretation. In 2016, Prince's sudden death stunned the world. Initial reports claimed he was suffering from the flu, but the reality was an opioid overdose, requiring an emergency Narcan injection. The official cause of death was a self-administered accidental overdose of fentanyl from counterfeit pills. Prince's case is a tragic example of how a hidden addiction can lead to a fatal outcome. When actress Brittany Murphy died at 32, the initial shock was immense. The autopsy painted a tragic picture. Murphy's death was accidental, caused by a combination of pneumonia, iron deficiency anemia, and multiple legal drugs. It was a perfect, tragic storm of treatable conditions. The tragedy was compounded when her husband died months later from the same causes. Brittany Murphy did not die from Hollywood excess, but from a cascade of treatable medical issues that became fatal. The story was not one of scandal but of preventable sickness. Tom Petty's death in October 2017 sent waves of grief across the globe. Months later, a report revealed a more complex story. An accidental overdose due to multiple medications, including fentanyl. Petty was suffering from emphysema, knee problems, and a fractured hip. His family explained he insisted on touring, performing in excruciating pain. His death highlights the danger of opioids and the immense burden of pain. When Heath Ledger was found dead in his New York City apartment, he was at the peak of his career. The news was shocking, and speculation ignited. The media narrative focused on a possible overdose. The death was ruled an accident. Acute intoxication from prescription painkillers, anti-anxiety pills, and sleeping aids. Ledger had spoken about intense insomnia. Ledger's death serves as a stark warning about mixing medications. The tragedy, a brilliant artist was simply trying to get some rest. Michael Jackson's death in 2009 shocked the world. He was weeks from his comeback tour. The cause of death was initially reported as cardiac arrest. The autopsy revealed acute propofol intoxication, administered by Dr. Conrad Murray. Propofol, a surgical anesthetic, was being used at home for insomnia, turning the bedroom into a makeshift operating room. Murray was convicted of involuntary manslaughter, a case of profound medical malpractice driven by celebrity pressure. Carrie Fisher, the actress and writer beloved for her iconic role as Princess Leia and for her searingly honest humor, died in December 2016. The initial story was straightforward and tragic. She suffered a major cardiac event on a flight from London to Los Angeles, received immediate CPR from fellow passengers, and was rushed to a hospital upon landing. She passed away 4 days later. The world mourned the loss of its princess, and the cause of death was widely reported as a heart attack. Her mother, the legendary actress Debbie Reynolds, died from a stroke just 1 day later, compounding the sense of a family tragedy rooted in cardiovascular failure. Months later, the Los Angeles County Coroner's Office released the full autopsy report, and the story became significantly more complex. The official cause of death was listed as sleep apnea and other undetermined factors. The report also noted that Fisher had multiple substances in her system, including 3 hardcore street-bought substances, though the coroner could not determine if they contributed to her death. The key finding, however, was sleep apnea, a common but serious disorder where a person's breathing repeatedly stops and starts during sleep. This condition puts immense strain on the heart and cardiovascular system over time. This final report reframed the entire narrative of her death. The heart attack was not the disease itself but a symptom of a larger, underlying problem. Atherosclerotic heart disease was listed as a contributing cause, but the sleep apnea was the central named factor. This is a crucial distinction. It suggests that her death was not just a sudden, unpredictable event, but potentially the culmination of a long-term chronic condition. Sleep apnea is often undiagnosed or undertreated, and its sufferers can be at a much higher risk for sudden cardiac events, especially when combined with other stressors like international travel and potentially the use of other substances. Carrie Fisher was famously open about her struggles with bipolar disorder and drug addiction throughout her life. The toxicology findings were, in that context, not entirely shocking, but the emphasis on sleep apnea was a revelation. It provided a hidden physiological cause that went beyond the public narratives of her mental health and addiction battles. Her death was not simply a story of a heart attack or even of a relapse. It was a complex medical puzzle, a convergence of her known struggles with a hidden, physical vulnerability. The final act of her life was written not just in the starlight of her fame, but in the dangerous, silent pauses of her sleep. In August 2014, the world lost Joan Rivers. The 81-year-old went to a private clinic in New York for a routine throat procedure. During the procedure, she stopped breathing and went into cardiac arrest, later dying in a coma. Investigations revealed catastrophic medical errors. An unauthorized physician performed a laryngoscopy, causing her vocal cords to swell and cut off her air supply. There was a shocking systemic failure, leading to a medical malpractice lawsuit and the clinic losing accreditation. Her voice was silenced by preventable errors during a routine procedure. John Ritter, the beloved comedic actor famous for his role in Three's Company and a long, successful career, collapsed on the set of his sitcom 8 Simple Rules in September 2003. He was complaining of nausea, vomiting, and severe chest pain. He was rushed to a nearby hospital where he was diagnosed and treated for a massive heart attack. The doctors worked on him for hours, but his condition just kept getting worse, and he died that evening. The news was a profound shock. Ritter was only 54 and was known for his vibrant physical comedy. The initial diagnosis of a heart attack was accepted as the tragic but understandable cause of death. However, the autopsy revealed a different and devastating truth. John Ritter had not suffered a heart attack. He died from an undiagnosed aortic dissection, a tear in the inner wall of the aorta, which is the main artery carrying blood from the heart. This is a rare but catastrophic medical emergency. Crucially, the symptoms of an aortic dissection, severe chest pain radiating to the back, shortness of breath, and fainting, can perfectly mimic those of a heart attack. The doctors in the emergency room, faced with a patient showing classic heart attack symptoms, anchored on that diagnosis and followed the standard aggressive protocol, which includes giving powerful blood thinners. This is where the story becomes a true medical tragedy. The standard treatment for a heart attack is exactly the opposite of the treatment for an aortic dissection. Giving blood thinners to a patient with a torn aorta is catastrophic. It speeds up the bleeding and makes the condition dramatically worse. The doctors, believing they were saving his life, were actually hastening his death. This was not a case of negligence in the sense of carelessness, but a classic and fatal misdiagnosis. They were treating the wrong disease, a mistake driven by the deceptive mask of the symptoms. An aortic dissection requires an immediate CT scan for diagnosis, a test that was not performed. In the aftermath, John Ritter's family, led by his widow Amy Yazbek, launched a foundation to raise awareness about aortic dissection. They learned that Ritter had a family history of the condition, a silent piece of medical history that could have raised a red flag. The case became a landmark in the study of misdiagnosis, highlighting the dangers of anchoring bias and the need for doctors to consider aortic dissection in their differential diagnosis for chest pain, even when a heart attack seems obvious. John Ritter's death was caused by a hidden condition that deceived his doctors, a tragic reminder that in medicine, what seems most likely is not always the truth. Corey Haim, a teen idol famous for films like The Lost Boys, died at 38. Headlines suggested a drug overdose, fitting his troubled life, but the autopsy revealed a stunning truth. Haim didn't die of an overdose. He died from pneumonia, complicated by a severely enlarged heart. This case highlights the danger of judging a person by their public persona. The truth revealed a damaged heart, not a fatal mistake. There is a sacred pact between a patient and a doctor. We come to them in our most vulnerable states, expecting care and competence. Medical negligence is a profound violation of this pact. It's more than a mistake, it's a failure to provide expected care. It's when the healer becomes the agent of harm, a betrayal leaving scars of disillusionment. When negligence leads to death, the betrayal is absolute. Death occurs due to preventable errors, lapses in judgment, or reckless disregard for safety. The doctor becomes the focus of anger and questions. These are fundamental breaches of duty, failures in patient safety. Trust is broken between the public and the medical profession. The hands we trust to save us can sometimes fail us. The death of a loved one is devastating. When caused by suspected medical negligence, doubt and suspicion arise. Grieving families become investigators, scrutinizing timelines and questioning decisions. This fight for answers is emotionally draining. Families challenge institutions, facing silence and learning medical terminology. Consider John Ritter's family. His widow, Amy Yazbek, sought public awareness after his misdiagnosed aortic dissection. The fight for answers becomes a fight for meaning, to prevent future errors, turning private pain into public good. Preventable deaths create waves that reshape patient care. A family's quest for answers transforms into a public drama in a medical malpractice lawsuit. Every detail is dissected, presented as evidence, and argued by legal teams. The pursuit of justice requires them to sacrifice their privacy. The courtroom becomes a battleground of narratives. The Michael Jackson case exemplifies this public drama, turning viewers into armchair jurors. This scrutiny adds pressure as they grieve and fight for justice. A verdict validates their struggle, holding the responsible party accountable. However, it's never a true victory, rarely providing emotional closure. Not all fights for justice end in a public courtroom battle. In fact, the vast majority of medical malpractice claims are resolved long before they reach a jury. They end in a quiet, confidential settlement. In this process, the hospital or its insurance company agrees to pay the grieving family a sum of money in exchange for dropping the lawsuit. A crucial component of this agreement is almost always a non-disclosure agreement, or NDA. This legal document binds the family to silence. They are forbidden from ever speaking publicly about the details of the case, the amount of the settlement, or even the nature of the negligence that led to their loved one's death. On the surface, a settlement can seem like a pragmatic solution. It spares the family the emotional trauma and uncertainty of a lengthy trial. It provides financial compensation that can help with lost income, funeral expenses, and the costs of raising children left behind. For the hospital, it avoids the risk of a much larger jury award, and perhaps more importantly, it prevents a public relations disaster. A quiet settlement allows the institution to manage the narrative, to avoid the damaging headlines and the public admission of fault that would come with a trial. It is a transaction designed to make a problem disappear as quietly as possible. However, this resolution comes at a steep price. The price of silence. The truth of what happened, the specific errors, the systemic failures, the names of those responsible, is effectively buried. The NDA ensures that the story remains a private secret, not a public lesson. This means that other patients may be unknowingly put at risk by the same doctors or the same flawed hospital protocols. The settlement resolves the financial claim for one family, but it does nothing to fix the underlying problem that caused the tragedy in the first place. The opportunity to use a personal tragedy to spur systemic change and protect future patients is lost, sealed away behind a legal document. This practice of settling cases with NDAs creates a troubling paradox. While it provides a form of justice for an individual family, it can perpetuate injustice for the community at large by allowing patterns of negligence to continue unchecked. In the world of celebrity deaths, where public interest is high, the pressure to settle quietly can be immense. The family is forced to weigh their desire for public accountability against their need for private closure and financial security. The price of silence is a heavy one, and it raises profound ethical questions about a legal system that often prioritizes confidential resolution over transparent truth. While many stories of medical negligence end in the silent compromise of a settlement, some become powerful catalysts for change. When a family refuses to be silenced, or when a case is so egregious that it captures the public's attention, a personal tragedy can transcend its own circumstances and force a reckoning within the medical community. The death of one person can lead to the implementation of new laws, new hospital protocols, and new educational standards that can save countless future lives. This is honestly the most meaningful legacy a victim of negligence can have. Their story becomes a turning point, a lesson etched into the very fabric of the healthcare system. The case of John Ritter is a powerful example of this transformative potential. Following his death from a misdiagnosed aortic dissection, his widow Amy Yazbek established the John Ritter Foundation for Aortic Health. Her work has been relentless, focused on raising public and physician awareness about this deceptive condition. The foundation has developed Ritter Rules, a simple list of risk factors and symptoms designed to help doctors and patients recognize the signs of aortic dissection. These rules are now taught in medical schools and displayed in emergency rooms, directly influencing how patients with chest pain are evaluated. A single tragic misdiagnosis has led to a fundamental shift in diagnostic practice. Similarly, the death of Joan Rivers prompted significant regulatory action. The investigation into the clinic where she was treated revealed shocking lapses in safety and professionalism. As a result, the clinic lost its federal accreditation and was forced to overhaul its procedures. The case served as a stark, high-profile warning to outpatient surgical centers across the country about the critical importance of adhering to patient safety protocols, proper credentialing, and emergency preparedness. The story of her preventable death became a powerful teaching tool for regulators and administrators, highlighting the dire consequences of a lax safety culture and reinforcing the standards that all patients deserve. This path from tragedy to reform is the most hopeful outcome in the aftermath of medical negligence. It demonstrates that a family's fight for answers can have a profound and lasting impact. It channels grief and anger into constructive action, ensuring that a loved one did not die in vain. These changes, whether it's a new law, a hospital checklist, or a public awareness campaign, become a living memorial. They are a testament to the power of a single story to shine a light on a hidden danger and inspire a collective commitment to do better, building a safer medical future on the foundation of a heartbreaking loss. The story of a death by medical negligence is never truly over for the family. They carry the burden of what if, a life sentence of regret. This alters their relationship with the medical world. Trust is shattered, replaced by skepticism and fear. The preventable nature of the death forever colors how we remember them. The negligence becomes a permanent part of their biography. It robs them of a peaceful final chapter, leaving a legacy tinged with sorrow. The toll is measured in the enduring pain of those left behind, intertwined with anger and injustice. The haunting uncertainty is the heaviest toll of all. In the digital age, news is a constant stream. When a celebrity dies, the 24-hour news cycle goes into overdrive. The pressure to be first often triumphs over accuracy, filling airtime with speculation. This fuels public skepticism with contradictory information. Suggestive language and open-ended questions frame the event as a puzzle, inviting public speculation. The media creates intrigue, prolonging uncertainty and maximizing engagement. This shapes our collective memory, creating an anchor of suspicion that's hard to lift, even after the official report. The news cycle manufactures mystery, setting the stage for enduring public skepticism. The internet has democratized investigation. No longer are we passive consumers of news handed down by established media outlets. The rise of social media, dedicated forums, and podcasting platforms has given birth to a new and powerful figure, the armchair detective. These are not ghoulish conspiracy theorists, but dedicated fans who feel a genuine connection to the celebrity and a deep sense of injustice about their death. Armed with search engines and a global network of fellow fans, they embark on their own collaborative investigations. They meticulously construct timelines, cross-reference news reports, and dig up obscure interviews, all in a collective effort to piece together what they believe is the true story. These fan communities become virtual incident rooms, buzzing with activity 24/7. A fan in Australia might discover an old photo that seems to show the celebrity looking unwell, while another in Ohio might find a public record detailing a past prescription. Information is shared, debated, and analyzed with a rigor that can sometimes rival that of professional journalists. They pore over autopsy reports, using online medical dictionaries to decipher complex terminology. They become experts in toxicology, pharmacology, and legal procedure. This intense, crowdsourced scrutiny can uncover inconsistencies or overlooked details that the mainstream media, in its haste, may have missed, providing a valuable counter-narrative to the official story. The driving force behind this phenomenon is often a profound sense of empathy. These fans are not just solving a puzzle, they're defending the legacy of someone they admire. When the official narrative seems to unfairly tarnish the celebrity's reputation, for example, by hastily labeling a death an overdose, the fan community rallies to find evidence that tells a more compassionate story. They might focus on the celebrity's struggle with chronic pain or the pressures of their career, reframing the narrative from one of personal failing to one of tragic circumstance. This desire to protect and honor the memory of the star is a powerful motivator for their deep-seated skepticism of simple, often judgmental official explanations. Of course, this decentralized investigation has its own dangers. Without the editorial standards of professional journalism, misinformation can spread just as quickly as valid insights. A plausible-sounding theory can be repeated so many times that it becomes accepted as fact within the community, regardless of its basis in evidence. However, the rise of the armchair detective is an undeniable feature of modern celebrity tragedy. It represents a fundamental shift in the power dynamic of information, where a passionate and organized public refuses to simply accept the first draft of history and instead insists on writing their own, often more nuanced and empathetic version of events. Public skepticism about celebrity deaths ranges from healthy critical thinking to wild conspiracy theories. At its best, skepticism means questioning narratives and seeking evidence, as in Tom Petty's case, where context matters. At its worst, it devolves into baseless conspiracies, rejecting facts and inventing elaborate plots. The digital age blurs these lines. Online platforms amplify both thoughtful questions and unfounded suspicions. Algorithms can trap us in echo chambers, escalating doubt into paranoia. The challenge is to distinguish evidence-based inquiry from fantasy, honoring truth without disrespecting the deceased. Once a narrative about a celebrity's death takes hold online, it can become an inescapable truth. Algorithms reinforce our biases, feeding us content that confirms our suspicions, and creating powerful echo chambers. In fan communities, skepticism of the official story becomes a badge of belonging, making dissent difficult. Over time, alternative theories harden into legend, outlasting official reports. Brittany Murphy's case shows how these stories persist, regardless of evidence. The internet ensures the mystery never dies, transforming fact into perpetual speculation. Modern media can make a chosen narrative more powerful than the documented truth. The death of a public figure pits the public's demand for answers against a family's need for privacy. Celebrities' lives are public, but their deaths are deeply personal for loved ones. Detailed autopsy reports can inform and protect the public, but also invade a family's grief. Media must balance transparency with compassion, avoiding sensationalism. Withholding information can fuel suspicion, oversharing can feel cruel. The real challenge is honoring both the public's need for truth and the family's dignity. Absolute certainty in medicine and death is rare. We crave clear answers, but real cases are filled with ambiguity and complexity. Medical errors, systemic failures, and the body's unpredictability mean the truth is often nuanced. High-profile deaths like Prince or Joan Rivers reveal vulnerabilities in the systems we trust. Accepting uncertainty doesn't mean giving up, it means seeking understanding, not easy answers. Sometimes a death certificate is just the start of the conversation. By embracing complexity, we move toward compassion and away from impossible certainty. Exploring hidden causes of celebrity deaths is ultimately about empathy. Our fascination comes from a desire to understand, not judge, those we admire. We see stars as vulnerable humans and families as advocates for truth and justice. Empathy extends to medical professionals, recognizing both individual errors and systemic pressures. True compassion means seeking reform, not just blame. By choosing empathy over judgment, we honor both the deceased and those left behind. In the end, we remember their full humanity, refusing to reduce their stories to simple cautionary tales. A final reflection. Honoring memory by seeking understanding. Why does it matter? It matters because how we tell the story of a person's death defines their life and legacy. Seeking a more complete understanding is our final act of respect. This journey has armed us with a toolkit for more critical and compassionate engagement. This knowledge empowers us to be better witnesses to future tragedies. It encourages us to wait for the full story, not just the first draft. When channeled correctly, our collective skepticism is a drive for accountability and progress. Every life deserves a death that is investigated with rigor and reported with honesty. In that truth, we find a deeper appreciation for the lives they lived. Thanks for watching, and let me know your thoughts in the comments.